October 18th to the 24th, and today we're learning all about the contributions pharmacists and technicians make to patient care in hospitals and other healthcare settings.
So joining us now is Greg Murphy, registered pharmacist and emergency medicine pharmacist for Seton Medical Center, Harker Heights. Thanks for being here today.
Thanks for inviting us.
I guess first of all, how have things changed during this time with your job?
Well, truly unprecedented times.
Yeah.
You know, we can only let certain people in, and visitors are limited. And but we do encourage people to be a little bit more prepared and take a little bit more control of their own health care when they come to see us.
Meaning what? What would your advice be?
Meaning we need a list of your medications, and you know, most everybody has one of these days.
Yeah, I'm familiar.
And if you can take a picture of your medication list or your medication bottles, have the dosage, the strength, and how you take it when you get there, and not bring your medicines with you in a bag.
Okay.
That would be most appropriate, because we can't send out for them and have them come in because of safety reasons. And it's just good health care to have a list of your medications with you at all times.
True.
So what do pharmacists do, just in case people don't know at home? Tell me your overall job.
Well, when somebody comes to the hospital, well, we do a lot of things.
Yeah.
But, you know, we make sure your medications are correct for the system. So if you do spend the night with us, we can continue your medications in a safe way. We also provide safely everything to you during your hospital stay. There's multiple checks. The patient comes first. Everything is safety, safety, safety at all times, regardless of COVID-19.
Mm-hmm. For sure. What is the stress level of your job? I've always wondered that. I mean, it's always busy in a pharmacy. There's so much to keep track of. Obviously, you're very well trained and excellent at what you do.
Well, actually, I'm 25 years old. This just no, the stress level is you getting used to it. You know, being in healthcare, taking care of lives is stressful in itself. We have to make sure everything is perfect.
Yeah.
We can't make mistakes.
Yeah.
Is there a need for pharmacists at Seton?
Oh yeah, we have a whole staff of pharmacists at Seton. Well, we cover from 6 a.m. till midnight, 7 days a week.
So you need a lot of people, right?
A lot of people. Everybody has medications, and it's all got to be right.
And what's your training process like?
Well, it's a doctoral program, so it's 6 years at a major university, 2 years prerequisites, and then 4 years of the actual core curriculum.
You talked about the list of medications and the things we can do to prepare. What are other ways that we as patients or customers can be helpful to you in getting your job done the right way?
Well, other than, you know, making sure that you have your medication list with you, either on your phone or a list in your wallet or purse, okay? Being cognizant of your own well-being, like keeping baby aspirin in your home in case you have chest pain or an emergency situation. Calling 911 when you're in trouble, and not taking the car ride with your loved one, because your first responders give you an astronomical advantage on survival if you're in an emergency situation.
That's so true.
And right now, the safest place you can be is in a hospital because of the checks and balances that we have. Hospitals are a business just like anyone else, and we probably have the most rigorous safety program for people coming into the hospital to keep you safe, whether a pandemic or not.
Wow.
So don't hesitate not coming right now, because we are the safest place you can be.
Yeah.
You said something that made me think, what are maybe the basics, in your opinion, that we should have at our at-home medicine cabinet? I mean, obviously, specialized medications is what you do, but is there a couple things we should just have at home, or do you feel comfortable saying?
Well, knowing, you know, I would say knowing the poison control phone number is very important, especially if you have small children. The baby aspirin if you're over 50, normally, and not relying on friends or family to take you in an emergency situation to the hospital, because they cannot do CPR on you. Maybe they can, but they can't while they're driving.
Yeah, yeah. No, that's great advice.
Where can people go to learn more about Seton Medical Center?
Our website is setonharkerheights.net.
Okay.
Well, thank you for the work that you do and for this information. This was so valuable today.
Thanks for inviting us.
Right on screen.
We
right
appreciate
there.
Yeah, the address is right there, and stay safe and well. Thank you.
Thank you very much.
All right.